Could this be a game changer? High hopes for a new antibody test for COVID-19. It'll show whether or not someone's ever been infected with the virus and should be widely available very soon.
I anticipate that it will be rapidly rolled out in the days and weeks to come, as soon as it is practical to do so.
But how much of a difference will it really make in the battle against the pandemic? We'll look at all the details. Also tonight, a record slump in A&E admissions, why people are staying away from hospital emergency departments. Beaten and robbed in his own home, England's Dele Alli is attacked at knife point in a £2 million raid. And how at least some good can come from lockdown. The new spirit of community forged during tough times.
This is the ITV Evening News with Mary Nightingale.
Good evening. The government says a new accurate test which can tell if someone's been infected with coronavirus is very exciting and very good news, they say. The blood test made by the Swiss company Roche looks for antibodies to see whether a patient has been infected and may have some immunity. Health chiefs say it will be rolled out rapidly, with frontline health workers getting access first. But the test can't actually show how immune anybody is, or whether indeed they could catch it again. Now, the news came as the number of UK deaths rose by 428 to a total of 33,614. Figures revealed that in England, more than a quarter of those who've died in hospitals with the virus suffered from diabetes. And the number of people going to A&E departments in England fell by more than half last month. We'll get more on that and all of that in just a moment. First, here's our science editor, Tom Clark, on what the new test could actually mean.
Switzerland has a reputation for precision, and it seems their major drug company Roche has more than lived up to it. Their test for coronavirus antibodies passing validation here in the UK with flying colours, along with another test made by America's Abbott Laboratories. Test the Prime Minister called game-changing.
When can we expect to see their game-changing potential actually deployed in this epidemic?
I anticipate that it will be rapidly rolled out in the days and weeks to come, as soon as it is practical to do so. I also anticipate that the focus will be on the National Health Service and on carers in the first instance.
A moment too soon for those on the front line who desperately want to know if they've had COVID or not.
People working within the NHS, if we can do anything to just help them feel that slight sense of relief at an otherwise very, very stressful time, then that would be absolutely fantastic.
The existing PCR test can only detect if someone is currently infected by taking a nasal swab and looking for signs of the virus itself. An antibody test examines a blood sample, looking for the special proteins or antibodies the body makes to fight off the virus. These Y-shaped antibodies remain in the blood long after the infection is gone, proving the virus was once present. And the new tests are very reliable, 100% accurate, identifying when someone has had COVID-19. And when they haven't had it, it can tell 98.8% of the time, delivering very few false positives.
The swab goes right to the back of the throat, both sides by your tonsils.
Today, the Office for National Statistics produced the first snapshot of how many people in England currently have the virus, around 150,000. But what we really need to know is how many of us have had it. Antibody or serological tests can do that.
Any serological test which is adequate and sensitive is going to have a major impact on working out who's had this in the country and who hasn't. And that, of course, will have a major impact on planning and eventually moving to some form of loosening of the lockdowns.
What the government scientists are less certain about is whether the new test can tell if someone is now immune to COVID-19. For that, we have to wait for the science to catch up with the virus.
Well, Tom is here. Now, this looks exciting. It is a positive step forward, but how much difference will it really make?
If this test, and there is another one made by another company, and there could be more that pass validation by the government, prove successful, massive difference. The big question we still haven't got an answer to is how many people in the UK have had the virus. If you're thinking about lifting lockdown, if you're thinking about changing behaviour in some way, you really need an answer to that question. This would give us a pretty reliable answer. It doesn't just tell us who's got it now, but who's had it since the outbreak began. What it might not be able to do, and what we really need a test to be able to do, is tell us, though, who is immune to COVID-19. That's the answer that healthcare professionals want to know, care workers want to know, and each of us as we go about our daily lives, have we got immunity? We don't know if it'll do that yet, but once we have that test, it really would be the game change that the government keep referring to.
OK, so we keep our fingers firmly crossed then. Tom, thank you very much indeed. And there is a full guide to the antibody test on our website. That's itv.com/news. So we've heard then the new antibody test should make it quicker to track the spread of the virus and even help control the outbreak. New data shows that the northwest of England has become the latest hotspot. 8 out of the 10 places with the highest infection rates are currently in the north. In Barrow-in-Furness in Cumbria, residents are 3 times more likely to catch the virus than those living anywhere else in England and Wales. Damon Green reports from Barrow on what might be behind the rise.
This town has been hit hard by coronavirus, so many families grieving here. Brian Arrowsmith was a legend in Barrow-in-Furness, a player and former manager of the local football team.
I saw him in the ambulance on the Sunday evening, and the following Sunday he'd passed away. This virus isn't going anywhere for a long time. We need to be vigilant of it and respect each other's space completely and do everything we can to look after each other, but most importantly, the NHS workers, you know.
The streets are still quiet, but everywhere you see the partial easing of the lockdown, queuing at the bank, queuing to get into the tip at the edge of town, and the queue to get into the drive-through KFC, opened yesterday, stretches all the way around the retail park. Barrow has some of the most deprived neighbourhoods in the whole of Cumbria. Some suggest this is a factor in the rate of infection. Public health officials say the high number of tests by the local NHS trust may simply have found more cases. If not, the town's MP says he would back a longer local lockdown.
So if we find out there's a specific problem in Barrow or the wider Furness Peninsula, then absolutely that's what we should be doing. And the Prime Minister said as much when he gave his speech.
Coronavirus has had a terrible impact on so many people in so many places, and Barrow seems to have had more than its share.
It's hard. I've got 2 kids, I've got grandkids, can't see my mother. She's only in the next street, so it's hard.
I think we should extend the lockdown, see what happens in June, and then maybe extend it a bit more.
Oh, you've got to be positive. Definitely got to be positive. Won't last forever, I hope.
All people here can do is carry on and try to live their lives. Damon Green, ITV News, in Cumbria.
Well, the coronavirus crisis is expected to cost the UK taxpayer £123 billion, and that's according to the spending watchdog. The Office for Budget Responsibility predicts that government borrowing could reach £300 billion this year alone, as the UK heads towards the worst economic slump since records began. Let's move on now to the effect the outbreak is having on some of our hospitals. And new figures have shown a huge drop in admissions at accident and emergency departments in England. In April, the number of people going to A&Es fell by 57% to the lowest on record. Well, our health correspondent Emily Morgan is here. Should we be surprised by this?
In many ways, no. Not least because A&E staff have been warning us about this for many weeks. But a drop by 57% in admissions is huge, isn't it? And I think there are a number of factors going on. I think, firstly, some patients are not dialing 999 because they're scared about contracting coronavirus once they get to hospital. And secondly, they also don't want to add to the pressure NHS staff are under. The problem is there are probably many patients, many people sitting at home who probably do need to go to hospital. They do need to be checked out. They could be making things worse for themselves. Specifically, people who may have had a minor stroke or those with heart problems. Cancer referrals are also down, a drop by about 8%. And again, that could be people putting off going to their GP because of the coronavirus. But the NHS's message is, we're open, please come. It might be better for you in the long run.
OK, some more figures out today. Really stark figures on who's actually dying from this virus and showing how vulnerable the vulnerable are.
Yes, absolutely. These figures, this data is from NHS England. They've put out deaths by pre-existing conditions. And the stark figure I think you're probably talking about is that 26% of those who've died from coronavirus had diabetes. Now, we know those who've had diabetes are at risk. They are in a sort of greater risk group. But it begs the question whether those with diabetes should actually be better protected and better supported.
OK, more on that, I'm sure, as we get it. Emily, thank you very much indeed. Still to come, the ITV Evening News, the remarkable tribute to an NHS consultant who lost his life to COVID-19. Plus, the town where thousands have come together to help each other through this crisis. And those stories and more after the break. Join me then. Back now, streets across the UK will be filled with applause and cheers again, no doubt, tonight. As people join the weekly clap for carers, there has certainly been no let-up in the bravery of those on the front line. People like consultant Tariq Shafi, the 61-year-old who worked at Darrant Valley Hospital in Kent for 13 years, died after contracting coronavirus. Two of his sons told Rebecca Barry he was loved and respected by everyone he met and helped.
The response from his colleagues reveals just how highly he was regarded. Hundreds stood in silence outside Darrant Valley Hospital, where Tariq Shafi worked as a consultant. But his loss is not just being felt by his work family.
You know, my mom always says it's like the ground's been taken underneath her feet, and you almost feel lost. Dad passing has been such a massive loss to us as a family, and it's left such a void.
Even when he fell ill with coronavirus, he put his patients first. Even when he too became a patient at the very hospital where he'd worked.
Even to the point where he was struggling a lot with his breathing, he would still continue his telephone clinics. Even when Dad was getting more and more unwell, when we were thinking about having to go on to ventilation. But the only thing Dad said is, he said, make sure my patients are transferred to somebody.
The humanity of the man.
Karen is one of the many patients who feels indebted to him. Dr. Shafi treated her after her cancer diagnosis.
To lose such a giant from medicine is such an expensive price to pay.
She asked us to pass on this message to his family.
I've never met anyone like your dad. Dr. Shafi walked in to my room, popped his hand on top of mine. He looked me in the eye and he said to me, we will look after you. And I will never, ever forget that. Please take some comfort, if you can, from what your father has done for this world.
Sort of gave me more sort of goosebumps. You know, it wasn't just us who loved Dad. Many, many people around the world loved Dad.
This doctor's legacy lives on in the many lives he saved. His children, all medics too, hope to follow his example. Rebecca Barry, ITV News, Dartford.
Remembering consultant Tariq Shafi. Well, moving on now, the government has announced a £2 billion investment in the country's transport network as part of its efforts to kick-start the economy after lockdown. £1.7 billion will be spent on local roads as ministers encourage more people to walk, cycle or drive wherever possible to avoid congestion on public transport. Products in high demand during the coronavirus crisis are still being sold at inflated prices online, according to the consumer group Which. They say items such as hand sanitizer, cleaning products and toilet roll are changing hands for double the average supermarket price on popular retail websites. And new research has shown that 1 in every 8 households in Great Britain has no access to a private or shared garden. Natural England says Londoners are especially poorly served, and black people are 4 times less likely than white people to have outdoor space at home to enjoy during lockdown. Now, the England star footballer Dele Alli has described the horrible experience, as he put it, of being punched and robbed by armed raiders in his North London home. Burglars armed with knives made off with watches and jewellery worth around £2 million. Paul Davis has more.
Driving his Rolls-Royce away from Tottenham's training ground this afternoon, Dele Alli, apparently none the worse for his ordeal, was returning to the luxury home where he and those closest to him were threatened and robbed just a day earlier.
Hey guys, I hope everyone's keeping well and staying healthy.
It is the home where the Spurs and England star has spent lockdown, keeping fit and healthy until his personal safety and that of his inner circle was confronted by a very different kind of threat early yesterday morning. Dele Alli had been playing pool with his brother, their 2 partners and a family friend when the masked intruders broke in. The 2 men were armed with knives. It's understood they threatened Ali, struck the footballer and another male before stealing expensive watches and jewellery belonging to Dele Alli's model girlfriend, Ruby May. Ali is the latest in a long line of Premier League stars whose homes have been targeted by criminals. Most recently, the home of his Spurs teammate Jan Vertonghen was burgled and his family threatened at knife point while he was playing in an away European tie. The home of Liverpool's Sadio Mane was also burgled while he was playing, while Arsenal's Sead Kolasinac famously fought off knife-wielding thugs who tried to rob him and teammate Mesut Ozil. Today, in a brief tweet, Ali said, "Thank you for all the messages, horrible experience, but we're all okay now. Appreciate the support." Police will be studying CCTV images. It's thought the thieves may have used the nearby M25 to quickly leave the area. Paul Davis, ITV News, North London.
And fans may not have long to wait until the Premier League is back in action. The Culture Secretary said tonight he is opening the door for a return to professional football in England in June, if he says it's safe to do so, and if the league and the players can agree on the format. Some clubs have already returned to limited training, and the government has suggested elite sport could be allowed to return next month. Lots of issues, though, still need to be worked out, including where games could be played and whether they'd be shown on free-to-air TV. Well, here in the UK, we're still pretty reliant on home hairdressing with varying degrees of success. New Zealanders have been taking advantage of their first opportunity in weeks to enjoy a professional service. There were queues outside barber shops at 1 minute past midnight as lockdown rules were relaxed. But social distancing still applies in hairdressers, shops and restaurants, despite no new cases of COVID-19 being reported in the country since Sunday. And finally tonight, proof, if any, were needed that the outbreak is bringing people together. The Office for National Statistics has recorded a surge in a feeling of unity across the UK. That's due in part to the sterling efforts of communities up and down the country. In the latest in our series of In This Together, Rupert Evelyn has spoken to a group in Taunton in Somerset. They started small and they've now helped more than 10,000 people.
There are many ingredients that make up a successful community coronavirus response. Goodwill is perhaps the key. Their catering company currently closed. Jackie and Ed Cullen are keeping their skills sharp, making and delivering free meals.
Hi Jean, you okay? There's a nice hot meal for you there, my darling.
It may be about food, but the service is also social.
Are you okay?
Yes, lovely.
Oh, good. Thank you, enjoy.
91-year-old Jean is grateful for these socially distanced get-togethers.
I've been confined, so I've relied on people ringing me up or popping in to see me.
Dropping the meal is one thing, but actually having a 2-minute chat with them, asking them how they are, how their day is, it's a big difference and they're really enjoying it.
Michelle struggled since her son died a couple of years ago. When COVID hit, she was surviving with a few pennies to her name and dry cereal to eat. The community team stepped in, and she's now volunteering herself.
I didn't want to ask for help. I'm quite a proud person. Like, everything that's in my house, I've bought and things, but it kind of got to that horrible stage. I had nothing, absolutely nothing.
1,000 people in the area are sewing scrubs for NHS staff, which are being delivered by a local driving school. Prescriptions are being collected for those that can't get there themselves.
Do you know who the coordinator is?
Online or over the phone, Natalie Dyson is coordinating a small Somerset army.
Taking pets to vets, putting money on electricity and gas meters, you name it, we're there really. And we're set up really to respond at a local level, whatever the request may be.
Ditching their uniform for fancy dress, posties are raising money, goodwill and a desire to help. The ingredients for a first-class community response. Rupert Evelyn, ITV News, Taunton.
And just a reminder of our top story tonight. The government says a new accurate test which can tell if someone has been infected with coronavirus is very exciting and very good news. The blood test looks for antibodies to see if a patient has been infected. Health chiefs say it will be rolled out rapidly with frontline health workers getting access first. But the test can't show how immune people are or whether they could catch it again. And that's it for now. Julie's here at 10, but from me and all the team, stay safe, stay well. Bye-bye.